Hello, everybody, and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and as always, I'm excited that you're here. And we have a great guest in the studio with us today, which is rare, so thanks for coming in. Diane Larson on my right, maybe your left, however you're watching this. RDH, BSDH has over 20 years of dental experience. Diane is active in the ADHA, MNDHA, and although she is no longer providing patient care chairside, her passion is helping clinicians provide a higher quality of care for their patients by assisting in developing an evidence-based treatment plan. She considers herself an extension of every team that utilizes oral DNA services. Her total health approach is complemented by her nutritional knowledge. Diane, thanks so much for being here.
Yeah, absolutely. I'm glad I got the invitation and I couldn't resist coming. We're just down the road in Eden Prairie, about 15 minutes away. And I'm like, oh, I get to learn something new. Podcast. That's what everybody's doing. So I'm like, oh, I get to be on the other end instead of always listening. I get to be contributing.
Yeah,
So
thanks
thank
for
you for the
coming.
invite.
And it's funny, it's funny because we met recently in Louisiana, which
Yes.
is where I always see Minnesota dental people. It's never in Minnesota, right? But there's a lot of technology happening in dentistry right here in Minnesota, which I think we talked about. There's
Yep, absolutely.
dozens of
Mhm.
companies, which is great, from the big obvious ones like Patterson Dental and 3M, but
Mhm.
also OralDNA, what we're doing with tooth apps,
Sure.
with Voyager Dental and Quickly, and I mean, there's a lot of great
Mhm.
innovations going on. A
Yes.
little bit of your journey and how you got involved with OralDNA.
Sure, absolutely. When I graduated dental hygiene school in 2000, that was not my first taste of dentistry. I actually worked as a lab tech. I was making crowns and bridges. And I
You
real
say that like you're embarrassed about it.
it's just I love the art and the craftsmanship of it, and that's where you're a dentist. You
Yeah,
love the craftsmanship too, but at
absolutely.
some point you're just like, okay, I'm good at that, but that's not fulfilling to me. I
Hmm.
found out real fast that I was a people person and I needed people contact.
Oh, sure.
So then I looked at the profession and said, okay, let's go to dental hygiene school. I went back. I was living in the Twin Cities when I was a dental lab tech. And then I went back to Wisconsin for my dental hygiene degree and graduated in 2000. And I was prepared to be chairside for the rest of my life. And I was working in a couple of different offices and I wanted more.
Mm.
I felt that, okay, I got that patient to that level of care, but then the other patient came in and I did the same exact thing. And I'm like, why didn't that patient respond? So through continuing education, I actually got a scholarship through the Arrest and Rep here in the Twin Cities. I went
Another
to
Minnesota company. Yeah.
yeah, I went to a mastership, a consulting company mastership, and I was just like, oh my God, this is where dentistry could be. I never imagined that it could be. And it really only makes sense. You we're all medical patients. We've all gone to the medical doctor, and how many times have we left that clinic without having some lab work done?
That's true.
Very few times. So, being part of this kind of paradigm shift of dentistry sees it, we do something about it. Why not be proactive and use a clinical laboratory test like the medical providers do and really truly practice dental medicine? So,
Mm.
in that continuing education, I got introduced to oral DNA. And it was hard for me. I was like, oh, I've got my 1,500 patients that I'm
Hmm.
taking care of, and I want to take care of them. And I'm like, what do I do? And then I thought of all of the patients, the number of patients that I could impact by getting that dental professional to say, hey, I've got a higher quality of care, higher standard of care. I want to know more about you. I impact more than 1,500 patients,
Mm.
which is just gives me goosebumps all the time when I'm consulting with somebody from Louisiana or from Washington State to the tip of Florida to say, yeah, I helped that patient. So that's where I am. And oral DNA has grown over the years as well too. My initial role with them was more of a sales where I had the Dakotas, Minnesota, Wisconsin, and Iowa lots of windshield time.
Yeah.
Lots of windshield time, knocking on doors saying, "Hey, do you want a webinar? Can I have, or do you want a lunch and learn? Can I help you out there?" And then when Oral DNA, which was under Quest, which is a major medical
Mhm.
tester, switched to Axis Genetics in Eden Prairie, which Axis Genetics, or I should say, the owner of Axis Genetics, Dr. McGlennon, has always been with Oral DNA from day one. He was the medical director even under Quest. So when Quest decided to sell, Ron said, only makes sense. We
Mm.
know everything about it. Let's just bring him here to Eden Prairie. And then when I came back, I came into kind of this educator role. And now I'm director of clinical education. And I do webinars and I just am there for support, extension of everybody's team kind of thing. And any report, I'm here to consult on and just figure out what's next for our patient care.
Very
So,
cool.
yeah.
Talk a little bit about the diagnostic tests that you do, because if we're looking to shift to, because there are, yeah, so just,
Mhm.
and how you leverage those tests to be more preventive in.
Sure. So, first off, I want to say clinical science still diagnose, especially when it comes to periodontal disease. But
Mhm.
our MyPeriopath, our flagship test, another test called Alert 2, absolutely helps that clinician know more and confirm the cause. In most cases, there will be a bacterial cause. So, what
Mhm.
we learned in school to assume that it was a bacterial cause, whew, a lot of legal things didn't come about
Mhm.
because it is.
Yeah, 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 yeah,
So,
yeah.
our test confirms the cause, but think of the handful that aren't bacterial related. You're seeing clinical signs of periodontal disease, but maybe that patient's an undiagnosed diabetic.
Mhm.
Those clinical signs are going to be the same. And if you spend 3 months having that care, periodontal therapy, having that patient heal, and they come in 3 months and they still look the same because the reason why they had the bleeding in the first place was because they had undiagnosed diabetes,
Mhm.
you just wasted 3 months. That patient could have been working on their diabetes.
So are you concurrently testing patients for both the bacteria and then also for doing a diabetes screening?
Almost. Not quite there
Okay.
yet. Not quite there yet. So, right now, our big test is periodontal pathogens. What are the levels? Typically, that's going to incite an inflammatory response. Other tests in our test menu include genetic susceptibility, PV detection for oral cancer risk assessment,
Mm.
caries, bacteria. But our research and development at some point, maybe not immediately through saliva for like
Mm.
A1C or blood glucose, but we are definitely venturing into the blood chemistry space. Yeah, there's a lot of stuff coming down the pipeline in research and development. So,
Yeah, that's great. So
mhm,
you're right now your tests are all salivary diagnostics
yes,
for those conditions that you mentioned,
yep,
right?
correct.
Very cool. Now, there's a lot of talk on the when I'm looking, because I'm involved with a lot of venture capital and working with small startups. And
Hmm.
there's a lot of talk about salivary diagnostics.
Sure.
So have you seen this being a massive trend, like particularly for the audience who they're maybe they haven't really been exposed, even though there's a lot of for the early adopter
Hmm.
offices,
Hmm.
salivary diagnostics are a very hot topic. However, probably not. I'm making an assumption that you can validate or disprove that the broader dental audience still probably isn't really looking at salivary
Hmm.
diagnostics. Is that correct?
That is correct. So it is still oral DNA was probably one of the first commercial laboratories. If you look at our universities, they've been doing testing similar to that. That really is what brought forth our modern day periodontology
Hmm.
to say, oh, there is a bacterial cause. But it was easy for them to, in that dental clinic, take a plaque sample or whatever their collection technique was and walk it 2 buildings down to the microbiology lab and have the analysis. That wasn't convenient for you here
Yeah.
in Minnetonka. I'm okay, I could ship it to the Minnesota, but that means there's time or I got to get a delivery to get it over there.
Hmm.
So in 2008, 2009, there was a company in Germany who was doing something similar. Specimens were being sent there, and there was a mastermind that's kind of said, hey, let's keep it in the United States. And Ron got on board, and lo and behold, in this test menu and this collection technique of a 30-second swish and gargle
Hmm.
made it easy for you to ship it across the country from California to, at first, Tennessee, but now Minnesota, to have the analysis done.
Oh, cool.
So, what have we seen since then? Because we were one of a handful before the pandemic.
Mm.
Pandemic comes. What was every other word on the TV? Test. Do a test at home. Test here. Test there. Guess what comfort level came about from the public?
Oh, yeah.
Test. So when you walked through that door at the oral healthcare professional and they said, hey, we need a test, patient goes, that makes a lot of sense.
Hmm.
We do need a test. I want to be proactive for myself.
Mm.
I don't want to be that diseased person. So we have seen more and more companies, different collection techniques, variations on the kind of the same service kind
Hmm.
of thing. And we're only going to see it stay.
Yeah.
We really are. There's current dental hygiene programs, dental schools that have started to incorporate it in their curriculum, clinical curriculum. But it's going to need a book. Like maybe you need to write a book on salivary
Salivary
diagnostics.
Diagnostics. I can tell you the formula I used, and I'm happy to read it. Yeah.
Yep.
Yeah, that's
So,
great.
yeah, I finished my bachelor's through Minnesota State Mankato from 2013 to 2018. I was 100% full-time oral DNA,
Hmm.
100% salivary diagnostics. There were maybe 2 pages in all of that extra curriculum that talked about salivary diagnostics. So it
Wow.
takes a while for it to get incorporated. And it's those forward thinkers
Hmm.
that all of a sudden they find themselves in academia. And hey, we're bringing that salivary diagnostics to the next. So it just takes time. We're
Yeah.
excited to be along for the ride.
Yeah. So, what have you found over the last 15 years of you as oral DNA? It sounds like a little more than 15 years
Hmm.
of having the tests out there with the current modality, it sounds, of swishing and gargling. What are you finding? Because there's probably a lot of information that you're getting from your oral
Hmm.
diagnostics that wasn't available 30 years ago.
Sure. We started small. Our test menu back in 2010 was 3 tests:
Hmm.
a genetic susceptibility test, the periodontal test, the myperiopath, and the OraRisk HPV. Under Access Genetics here in Eden Prairie, we've expanded to caries testing, candida testing, herpes simplex virus, and chlamydia and gonorrhea. There's a lot of research out there. The more research that comes in that supports, hey, we need to be looking for that, or we need to be looking for this. I mentioned a little bit about the blood chemistry that we were potentially getting in there,
Hmm.
possibly having an A1C capability in the future. There's going to be a point of care where you actually are performing a clinical laboratory test through quantitative PCR sitting right here on your test,
Hmm.
on your desktop. You'll get test results in about 10 minutes.
Yeah, I think as a broad concept, this makes all the sense in the world. In fact,
Mhm.
I had an initiative that we've been looking at, we have on the shelf now called Screening Clean to be able to do a kind of like a, when you're performing hygiene, to do a battery of systemic
Mhm.
screening tests. But that's like you're saying, it's a long way out. What are, today for our audience, what are you seeing that dentists are doing to be successful using oral DNA screening products?
Sure. It definitely allows them to create a more personal treatment plan. Before, when I was in the hygiene chair, it was just like, you know what? We've used this and this on a patient that looks exactly like
Mm.
you. I'm going to do the same thing and keep my fingers crossed and hope it does the same thing for you. Now we're getting to a point where there's more and more tests out there that say, hey, when there's these more resistant bacteria, tissue invasive bacteria, then using those adjunctive therapies are absolutely needed.
Hmm.
So things like lasers, things like trade delivered medicaments, ozone therapies, different probiotics and prebiotics. Systemic antibiotics are also recommended on our report, but I truly stress with my nutritional background,
Hmm.
that would absolutely be my back pocket thing. It's not going to be my first go to, but if it's the only thing that you have, if you don't have all of those other things, then that's an additional therapy that you can help get those more resistant bacteria under control so that there's more predictable outcomes with that patient's care.
So basically, when you're looking at antibiotic therapy, you want to match the drug to the bug, right? Many times we're not
Correct.
even finding the bug.
Mhm.
And what you're allowing too is to have the treatment plan match the bugs, right? Kind of thing
Yes,
too for when it comes
correct.
to periodontal disease.
Correct. Yep.
That's very cool.
Mhm.
Yeah. So thank you for all the work you're doing educating dentists on this. I think it's gonna, like you said, it's gonna help millions of patients. For 1/3 of the population has periodontal
Yeah.
disease, right? We should at least be screening for that 1/3 too, right?
Yeah.
Which is an issue in a lot of dental practices too.
Yes, correct.
Where can people find out more information about the oral DNA
Yes,
testing?
absolutely. Our website has plethora of information there. That's oraldna.com. There's no upfront cost to become an oral DNA provider to get the collection kits so that when that patient says yes, or you find that one patient, you're ready to go to get that information for the patient. So, oraldna.com, and that will get you an access to me as well to schedule a webinar or consultation, whatever you need.
Thank you very much, Diane, for being on the podcast.
Yeah.
Great seeing you in person.
Yes.
And
Well,
yeah, take care.
yeah. Take care. Alrighty. Bye bye.